This is actually the interesting thing with Prism is it does move the world left and right, but it also bends space ever so slightly. So truthfully, if you shift the world up ever so slightly, it bends things back so that there's this ever subtle sense that you're walking up a hill, not in any sort of aggressive way, but it kind of pushes you back. So again, sometimes you might have someone who's a toe walker. Can we push that center back so that this becomes your new movement pattern? We can move them forward if you've got, so a lot of times when we're prescribing glasses, I'll actually test someone's balance, eyes open, eyes closed, destabilizing. And I'm getting a sense of, when we're mostly looking at vestibular, proprioception, what's happening to where they move in space, and what can I do with lenses to subtly help them reorganize?
All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. And Shed Light Cold Lasers has been a game changer for us at HML professionally and personally at home. Personally, on a personal note, I had a very bad bout of vertigo, and I got probably 85% there by going to a few different functional neurologists over the years to help me out with it. Then I bought this, and this is a game changer because one, it's portable. That means I can take it to the office, use it on patients all day, make sure it stays charged, come on home, and then throw it in my pocket and use that home. And this is what cleared up my vertigo. Now, professionally, the way it's been the game changer for us in the office is that it has cut our results down by 50%. This can get used on just about anything, any disease disorder that you can think of, it can pretty much get used on. Now, as far as how it has helped us out, it's cut everything down by 50% on our times. So when we're working with our kids with special needs, when we're working with our chronic neurological disorders, autoimmune diseases, to get those people into a good point that they're happy and that we're happy, times have been cut by 50%. You will definitely want to go check out shedlightcoldlasers.com or email Griswold at shedlightinformation@gmail.com, 518-338-6658. Welcome, everyone, to the Dr. Alex Show. And today we have a guest, first international guest that producer Nick pointed out, which is kind of cool. Dr. Paul Rollett. And I guess, did I say that correctly?
You did. Yeah, that's perfect.
Perfect.
Yeah.
Okay. Well, I got to sit in on a lecture with Dr. Rollett through IAFNR, International Association of Functional Neurosciences and Rehabilitation, for 2021. And he is an optometrist out of Canada, and he'll go over more of his stuff here in a sec. But he talked about how practitioners can better collaborate with optometrists, not only for visual acuity needs, but vision therapy. And vision therapy is a very popular thing. Some people like to poo-poo it because, like everything else that's new out there in the field of medicine, it likes to get scrutinized. But all of that aside, we're going to go over a lot of topics that are going to be very useful for not only kids, but adults, because we'll talk about sports vision therapy issues that can arise, anything to do with concussions, and then with kids, particularly learning disorders, talking about prisms, lenses, tinted lenses, anything along those lines. But Dr. Rollett, thank you for coming on. And as I said off air, seriously, having you talk about integrating vision therapy and collaborating really helped us not only understand like more of a better timeline on getting changes out of patients, because sometimes I know I'm very impatient and I'm like, oh, okay, maybe we need 8 weeks, not 2,
right,
to make changes. But also just the sheer expertise that goes into someone like yourself and all the extra details that because there's sometimes where we can only get a patient so far. So it's super great to have someone to send out to if they haven't seen someone for vision therapy. And it really woke my wife, Dr. Laura, and I up in that sense, because what we did is we sat there and we're going over the presentation and we're like, wow, we've really become tunnel vision on some patients because you get wrapped up in what it is you're working on. And even when you go and reassess or reexamine, you don't think like, oh, are there other options at this point of the game that would be good to send the person to? Or is there something I'm missing? So thank you for coming on, and thanks for the presentation.
Oh, it's very kind. No, as I was mentioning, it's the opportunity to present to a number of different professionals who again have different ways of thinking and viewing situations. It was kind of a growth opportunity for me as well to listen to some of the other presentations. So I'm glad it resonated with yourself and your wife. And yeah, I know you mentioned that it had some implications on how you practice, and so I think we're always just trying to evolve and grow. And so I'm glad you found it useful.
Yeah. Now, just so everyone knows, because there's bound to be someone in Canada listening, where exactly are you?
So I'm based in a city called Kelowna, British Columbia. So Western Canada. We're about 4.5 hours east of Vancouver. So we're sort of in an interior region, Canada's wine region. It's a lovely part of the country, and so we have our base there, and then we have we have a couple satellite clinics in adjacent smaller communities within interior of the province.
Awesome. And now today's Valentine's Day 2022. Are you guys buried in snow up there?
We are not. We're kind of in this like little nice microclimate here, and it's a lot of the Canadian cliches are kind of lost on us a little bit. It's not there's other areas to the east and the west where that would be the case, but we've got a nice sunny day. It was outside, no jackets, so yeah, it's kind of fortunate.
Wow.
It's a good place to live for sure. It's kind of this nice pocket where you can have a good work-life balance. I'll say it that way. There's snow on the ski hills, but in town, it's really lovely. So,
wow.
Yeah.
Well, it kind of sounds like living in Colorado. Not too bad then.
Yeah, kind of. I think that's probably a similar way, like a decent way to compare the climates for sure.
Cool. Well, something that's been burning at me, if you don't mind just going right away, because it even popped up last week, is when we're working with people, as you do, we got post-concussion, we got people that just want to get the best out of themselves, vision therapy for, let's say, sports or reading or whatever it is, and then learning disabilities, and then, of course, other neurodevelopmental disorders like autism, dyslexia, ADHD, things of that nature. But something that's really popped up is prisms. I've seemed to attracted a few kids and adults where I think the usage of prisms would come in handy. If you don't mind diving into that, because that can be kind of complicated, and I don't think a lot of people or patients or parents know about that.
No, yeah, I'm certainly happy to kind of discuss that topic. So Prism is a very interesting entity that it's something that you can add within glasses. You don't see it when you look at someone's. I actually have Prism in these glasses. They kind of look, like regular lenses. But essentially what it does is it shifts the orientation or where an object is in space ever so slightly. And when you prescribe it, with proper care and attention, it can result in, of course, better eye tracking skills, better orientation skills, and just overall better performance. So Prism is interesting because it's kind of this generic term, and the ways in which you can prescribe it can obviously be a little bit unique. We can, there's a bit of a rabbit hole there, but I would say that the main areas where we utilize Prism is we live in a very near-centered society. And so, a lot of people are looking to get back to screen use, computer use, reading more effectively and more efficiently. And in order to do that, our two eyes have to turn inwards and hold that posture for an extended period of time. Evolutionarily, our eyes are distance-seeking organs. They're designed to be focused in the distance, and we're kind of putting them under an incredible amount of stress with the amount of near-centered work that we do. So there's one area with Prism, if you have someone who's got screen sensitivity, reading sensitivity, frontal headaches, particularly when they're trying to engage at near, what you can do with Prism is you can actually ever so slightly shift the image of the world out to take some of the tension off of their eye teaming system. Now, you might look at that and say, are we adding a Band-Aid, something along those lines? But what actually tends to happen is it's often a lot similar. You put braces on the teeth to straighten them out. With Prism, when you prescribe it therapeutically, you'll often see that although you're supporting the system, it will move the eyes inwards more effortlessly, and over time you can move away from using it. So convergence or sort of screen tolerance is a big area where Prism can be helpful. Other areas are, when you have those patients who their orientation just seems a little bit off. Let's say it's someone who's always drifting to the right, to the left. We mentioned some, ASD clients who are always walking on their toes or things along those lines. You can utilize Prism to shift the image of the world ever so slightly in a more advantageous direction. And because vision tends to lead the motor system, because again, our eyes essentially kind of tell us where to go or where to move. If we've shifted them ever so slightly, then they can develop more effective movement patterns. So it's interesting when you have an eye exam, traditionally you think of sitting in this dark room, lights are off, you look down these little tiny pinholes and these tunnels, and you have to say which letters are clearer, darker, and blacker.
Yep.
When you're doing a little bit more of
worse.
a better
Better,
one,
worse.
exactly. And that's still part of it. So I wouldn't say like, that I'm, we still utilize that element. However, with the
Sure.
glasses, Prism in particular, a big part of is about seeing them move throughout space. So you've got a variety of different ways. Again, if we're shifting the world slightly left, slightly right. And we mentioned computer as well. You see it, I'm sure, all the time. People have this chronic neck forward posture. You can utilize Prism to actually push the center of gravity ever so slightly backwards so that they sit with better neck alignment. So suffice it to say, with Prism, essentially what you're doing is you're trying to take tension off of the visual system. So can help you with screens, can help you with people who are disoriented, dizzy, always drifting one particular direction, or again, people who are dealing with cervical or neck tension. And so you mentioned collaboration. For us, it's super critical that people are working with someone who's, evaluating and treating the neck as well, or giving exercises, strengthening in that particular region, because there are things we can do with glasses to kind of put people in a better position to succeed. But we also kind of want them working in this region effectively as well. So Prism, I think the main things where, can Prism help is, again, we talked about screen sensitivity, motion sensitivity is common. The obvious ones are things like double vision. So if you can't get rid of their double vision, Prism, you can actually move the world in closer orientation to where the eye is deviated. So I'm sure you see many clients post-injury who have, nerve palsies, and as a result of that, they're getting double vision. And typically double vision is your right and left eye are viewing the world in slightly different locations. So we can move the world to the location of the deviated eye and then work to train it into better alignment. So it's a way to just allow people to engage with the world more comfortably. And so, we often hear Prism glasses, and they can have a really, really profound effect, but much like the treatments that you do, it depends a little bit on, how much care and attention is put into prescribing them.
Sure.
But yeah, it can be helpful for particularly those patients who, maybe are not progressing the way you would typically expect.
Yeah. Now, to wrap people's head around it, is it basically like the lens is like a wedge where you're like maybe the larger side of the wedge is, let's say it's on the outside of the lens, and that would force the eyeball inward. Let's say if the person, quote, had a, quote, lazy eye that was going out, it would force the eye in. Okay.
Right. That's exactly it. Prism, we often think, there's the Pink Floyd music album of like light bending, and it really does work in that way. I do mention, so you're right. Prisms are essentially designed. You've got a thick base and a thin apex, and light is going to bend towards the base, which will move the eye towards the apex. So we're shifting things either, left, right, up, down. Sometimes to one eye, we shift it up, down. So I will mention the only subtle thing, a lot of times when you're prescribing glasses, when people hear that, they think, well, that seems a little bit concerning. We don't want to be moving the world aggressively. A lot of what we're using is, we'll often term it microprism or small amounts of prism. So we're talking, at a distance of 1 meter away, it's moving the world a centimeter. I guess I'm using, Canadian I don't know what that is in inches and feet, but it's a very small amount that we're shifting the world.
Yep.
Again, to coax and guide into the best direction possible.
Yeah, and I would assume in theory, because I've had some glasses that are prisms in my hand, and I'm blessed to say I don't have to have glasses at this point in my life.
Right.
I don't feel it. Like, you don't
Yeah.
feel the thickness difference per se.
No.
So, but that is absolutely huge what you said about neck pain, headaches, and prisms with working with computers.
Yeah.
Not only in the concept of you have to have your eyes come together, they have to converge, but then I guess you just alluded to you could have prisms to maybe have the eyes go down or shift the image of the world so that there is potentially making the eyes go down. That way the person's a little more upright.
Yeah, it's essentially what you do. You can orient it, and this is actually the interesting thing with Prism is it does move the world left and right, but it also bends space ever so slightly. So truthfully, if you shift the world up ever so slightly, it bends things back so that there's this ever subtle sense that you're walking up a hill, not in any sort of aggressive way, but it kind of pushes you back. So again, sometimes you might have someone who's a toe walker. Can we push that center back so that this becomes your new movement pattern? We can move them forward if you've got. So a lot of times when we're prescribing glasses, I'll actually test someone's balance, eyes open, eyes closed, destabilizing, and I'm getting a sense of, when we're mostly looking at vestibular, proprioception, what's happening to where they move in space, and what can I do with lenses to subtly help them reorganize. If they're always falling forward, I might want to use a prism to guide them backward. If they're always falling backwards, we might go the other direction. So motor elements are super key. And so, movement patterns is one piece, and then just near-centered sustainability, I guess, for computers, readings, phones, which are just, we live in a near-centered world. There's, I think we're going to be seeing, truthfully, more and more of this element being. We probably prescribe glasses with Prism, I would say 95% of my patients, and it's just because of the nature of we're pretty much a referral center only. So it's not that everyone needs Prism, but it's something where, if the symptoms we've talked about are plaguing someone for months and months and months, then I think that there's a lot that could be considered.
Yeah. So then are the usage of prisms, is that pretty common across optometrists, or is it kind of specialized in that regard?
You know what? It's interesting because we are taught in school how to prescribe primarily what we would call compensatory prisms. So let's say someone's eye turns in, let's move the world to align with that eye that's deviated inward. The eye goes up, let's move the world to align with that deviation. And that's helpful by all means. And I think that's kind of traditionally what we do. When you get more involved in sort of, the subfields, whether it's a developmental optometrist or neuro-optometrist where you work with different cases, you're often using Prism as opposed to a compensatory way, more of a therapeutic way. So, instead of the eyes going in, maybe we actually want to use Prism in a different orientation to train it to go out, as opposed to just put it passively where it naturally wants to sit. So I'd say the tenets of Prism are certainly taught in school. I know I've been an optometrist for over a decade, and I know it takes a while to get comfortable with Prism, and it's probably not, top of mind initially with glasses. We're seeing more, of course, with screens and devices. We're finding more and more, optometrists are getting involved with prescribing it, but it's definitely not. You'd want to maybe look for someone who within your area who does a lot of work with Prism, and you can even talk to their admin staff or talk to them directly, and usually you'll get a sense of that. So
yeah, and we'll have links for all of that in the show, because there's is it North American Optometric Rehabilitation Association. Did I say that correctly? NORA?
Yeah, Neuro Optometric Rehabilitation Association. That's right. Yeah.
Because we have one in the States, and then I know that there's a window here, and
Oh, yeah.
there's people running around.
Oh,
Uh,
okay.
Side note: the building we're in, it used to be the original post office in the town we're in.
Oh,
The
really? I love
studio,
that.
it's cool. The
Yeah.
studio is the safe room, so I'm in a safe. It's locked
Are
in.
you really? Oh,
Yeah,
wow.
like
So it's probably
super
soundproof then pretty well, I would
very
imagine.
soundproof.
Yeah.
And the window you see, there's that glass. It's uber thick. So every
Yeah.
once in a while, someone walks by and and I can normally just not have any issues, but I squirreled out there.
Right.
So,
No, it's
uh,
all good. I didn't even see him, so.
oh, good. Well,
Yeah.
anyway, so we'll have the links in there because I know
Mhm.
there's a great Canadian-based association. I'm sure there's others, so that way
Yeah,
people can get the info
for
and
sure.
find someone. So then, last question on prisms, at least I
Mhm.
can think of: could someone just get prisms without any correction in it? In other words, the visual acuity is fine, but maybe prisms would be useful for something.
Definitely. And that's kind of that's often sort of that's sometimes a bit of the barrier to entry for people when you're talking about, glasses, where, someone like yourself, you've never worn glasses. The story we've often told about glasses is, okay, you get them because you look across the street and the sign is a little blurry or the whiteboard is a little bit blurry. Prism is a little bit of a different entity. And so even people, many of our patients will come in and see 2020 or close to 2020. And so there is a little bit of an educational piece where you have to say, this is not designed to help you see things clearer, darker, and blacker far away. This is designed to allow you to be on your computer for a longer period of time. This is designed to dampen your dizziness. This is designed to allow you to walk into a grocery store and feel comfortable, or sit behind the wheel of a car and feel comfortable. So there's a difference between clarity and comfort of vision. And so even if the clarity is wonderful, the comfort can be off. And so again, it's for us, it takes some time with every patient about rewriting the story they've been told about glasses, because and also the other element is people are typically concerned, well, if I use this particular lens, am I going to need stronger and stronger with time, which is, what, many kids who get glasses in grade 3 or 4, their lens prescription gets higher and higher with time. So people have that story in their mind and in their head. And Prism doesn't typically work like that. It actually slowly, typically you're reducing it over time. And again, when you're collaborating with great allied professionals who are doing the work on the neck and the inner ear, in many instances, if not all instances, people end up moving away from the lens or giving it or maintaining a very small amount long term.
Love it.
Yeah.
God, that is just a huge epiphany. I mean, that is
Right.
awesome. For like stubborn toe walkers,
Right.
people that like we can't shake with headaches, working all day,
Mhm.
simple evaluation to whether they have glasses or not, to just go have it done. That
Yeah.
that's awesome.
Yeah.
That is just fantastic. So then, do you have anything else on prisms?
No, I think that, it's one of those elements where, I mean, I do often always mention, you referenced there's going to be links in the show notes of, um, where people might find someone who does a lot of work with Prism, because I do get a lot of patients who come in and they might mention, oh, I have Prism in my glasses, but it might have been prescribed in a compensatory way as opposed to a therapeutic way. So
Mm,
it's one of those things where I often mention, and it sounds like you've made some great connections there locally, which is great. Finding someone who, when you send someone to get Prism glasses, your patients should be coming back to you with a little bit of the wow factor, and if they're not consistently, then maybe you would want to, collaborate or work with, or, we're actually, myself and some colleagues are creating a bit of some courses and training on how to prescribe, therapeutically with prisms. So maybe just finding someone who you do get that that subtle wow factor, I think, is important. I just wouldn't, if someone comes in and says, oh, I've already got Prism in my glasses, it doesn't always mean that it's the optimal Prism. That's the only other thing I might mention. So
Yeah. Oh yeah, that kind of goes hand in hand with a lot of patients walking in general. Sometimes you have to
Oh yeah.
revisit everything.
Yeah.
Maybe it's been too long, or maybe it just wasn't quite sufficient enough.
Yeah. And you would get that in your profession too. You know, I've seen a chiropractor, I've seen so and so. You know, it doesn't always mean that the previous approach was what your approach is going to be. So
Yep.
that's the only other thing I'd say.
Cool.
Yeah.
So something we didn't talk about off air, but I'm sure people are going to have tons of questions about blue light glasses.
Mm-hmm.
Let's talk about those.
Yeah, it's there's quite a marketing push in that area, and I think that it is, you know, they have value. We have utilized them within the office in certain situations. If someone is, you know, doing a lot of screen use, the reality is blue light that's emitted from screens is certainly of higher energy than, you know, other forms of light, kind of within the spectrum, and it's designed for, you know, alertness and wakefulness, which can be helpful at certain points throughout the day, but can be a hindrance to, you know, other situations. So the major thing that we often say is, you know, if someone's doing a lot of screen use, we might talk to them about filtering some of the blue light that comes in later in the day so that you can, you know, get to sleep comfortably and effectively. However, blue light is really, really helpful for regulating our circadian rhythms. So you need to be cautious about how often and how frequently. I'm pretty opposed to just tossing it in your dress pair of glasses that you wear all the time, because again, we need that blue light in the morning to kind of get us going. So if you're filtering all of that or more than you need to, it actually can have some, you know, deleterious effects on sort of your sleep cycle. So it depends on when you utilize it. The other thing I often say is the filters can be really helpful. They help with screens, but they also can help with sort of, you know, fluorescence or artificial light sources. There are software and things that, you know, night mode on screens and f.lux and these, where you can actually reduce the blue light on your screen even to a higher level than what you get within a filter in your glasses. So I would say that it's a couple things are that blue light glasses, I think, have their place, you know, in today's society, but I really caution against people maybe wearing them all the time. You know, I don't think they should be in your full time. But again, I'm a big proponent of people having different glasses for different situations, much like, you know, we have different shoes for different, you know, you wouldn't go hiking in your dress shoes that you're wearing at the office. You might not want to be wearing the same glasses when you're doing screen work that you do when you're out and about in society. So you do want to be a little bit personally. I mean, my approach is I often turn down the blue emissions on the screen, and I sort of more so manipulate environmental light as well too. Like with, you try and have windows in your work environment. You know, I know a lot of people now have transitioned, they can work from home, and we've got a bit of a blog post that'll give you an outline on lighting recommendations. But the one thing is, they're probably not a catch-all for everything, the blue light glasses. And a lot of people will go online and get a pair, and you don't actually know how much blue light they're emitting. They also might not have the right strength. They might not have prism in them. You know, I just find that it's a really easy way for people to say, oh, I've got the blue light glasses to help my eyes. There's often a lot more elements that you can add in conjunction with the blue light filter that'll make you way more efficient. So I don't know, it's probably a long answer to say that they do have their value, but I would say you want to be probably a little cautious about full-time use of filtering blue light.
Yeah. Well, like a lot of new technologies out there, it's not just black and white,
right?
Said and done, on and off. But that is another huge note about going into wearing glasses, blue light filter glasses in the morning, because
Right.
it makes a lot of sense, because all that blue, it creates a lot of dopamine in the brain, and that's what helps to a degree wake you up, along with cortisol. And keeps you motivated and adds pleasure. So if you're maybe a little slow moving in the morning and you got blue light filters on, that might be a contributor.
Yeah, you want to take it off and get outdoors. That natural. I know, there's been a lot of Dr. Huberman, Andrew Huberman's done a lot of kind of like higher awareness podcasts on the value of light in the morning, and a lot of that light that you need is actually kind of on that blue end of the spectrum. So, an awareness of when you're filtering, I think, is the big element to consider.
Cool. That makes a lot of sense. So then, to kind of dovetail off that, how about sunglasses? What's your take on sunglasses? My wife and I were just talking about that a couple of days ago. Like, I used to not have to have sunglasses. Now it's like I can't go without them.
Yeah, it's interesting because I think there's a couple different avenues you can go down with sunglasses. I think the reality is with the extension of our lifespans and the longer that we're living, the reality is some of the ultraviolet light exposure, it might not have been an issue for us 500 years ago when our lifespan was short. However, now as people are living 80, 90, 100 years, that buildup of ultraviolet light exposure, particularly to some of the the small blood vessels in and around the eye, can create some problems for people as they get a little bit older. So you're right, there is a sensitivity that develops. If you don't wear sunglasses, you'll probably feel more comfortable on a bright day than if you're someone who kind of always wears them. But if you're thinking about playing the long game, I think having a good, filtering pair of sunglasses, something that's got a nice anti-reflective or coating or polarized to kind of cut glare off of water. It does feel better, but it's also looking at the long game of, okay, what does, I want to make sure that 70-year-old Alex has healthy eyes, so maybe I'll wear them now.
Right.
The big thing I do mention, because I'm sure many of your patients have light sensitivity, sunglasses, of course, aren't all made equal. So we do often, if you have a patient who has sunglasses, but they're still light sensitive, you might want to ask them, number one, are they polarized? Because that has a huge impact on reflected light off roads and off of water as well, snow, that kind of stuff. And then what tint they have is really important too. If you have, a gray for your really light sensitive patients, gray is often the best because it's a neutral density filter. It turns the world down equally in all different elements of the color spectrum. Whereas when you have something, let's say they've got a yellow or an amber, I mean, there's a reason baseball players always have yellow and amber sunglasses. It enhances your peripheral awareness and kind of motion detection skills, which is good in that environment. But if you've got someone who's super light sensitive, they might find that tint overwhelming. So we often, if someone's light sensitive, we might draw them maybe towards a gray or a brown polarized lens. If you've got an athlete, you might want to, we'll often do, some of our athletes, we actually have some, different ranges of kind of yellow and orange glasses that they might use in warm up to just warm up that peripheral awareness and motion detection.
Yep.
And then golfing, there's a whole lot. So for reading greens. So there's the one thing with sunglasses is, similar to Prism, it's a bit of a rabbit hole, but the big things for, some of the people that are listening are, asking them if they're polarized and maybe taking a look at the tint. And even if you're not sure, you just pop them on yourself and say, oh, that feels calm, or that feels really bright. And then you might say, hey, you might want to look at a different tint for these sunglasses. So I think that's, it's I don't think you need to wear it every second of every day, but dampening UV exposure over your lifetime is almost certainly to be beneficial to you later on.
Yeah. Well, like everything else, it's a bit of a balance.
Yeah. Oh yeah, for sure.
But
And we talked about that early morning sunlight. You don't want sunglasses for that. You want that full sort of spectrum, light. That's best for wakefulness. So,
yep.
So yeah, it's I wouldn't glue them to your face, but I wouldn't be avoidant of them either, I suppose.
And I think you had mentioned that in the presentation about morning light sunglasses. So it must have been you where I heard it from, because I was like, hey, that's a great reminder. So if I'm taking the boy to school in the morning, sunglasses are off. for instance, when I'm driving, sunglasses are off, but like the sunroof or moonroof isn't open, so I'm having less overhead
Right.
light,
Right.
which then, I don't know, called a week, and I was okay with having the morning sun beat in my eyes with the sun visor, and I was just fine.
Right.
And then what I can't tolerate personally, I know a lot of people is like, I have to drive west to go home. That's brutal.
Right. Yeah,
Brutal.
exactly. Yeah.
Can't do it. But
No, that's fair. That's fair. Those are the moments you might want to slip them off. And the one thing I'll mention, just because this might be a line of dialogue that some of the listeners might have heard, was the reality with kids. This is this is something also, of course, to be aware of. Is we do get, I think it's 70 to 80% of our overall lifetime UV exposure to our eye when we're young. When we're under 10 or 11 years old, because the crystalline lens within our eye is so clear and open to allowing all light in. So I am a fan of using sunglasses with kids for that reason, because if you want to leverage things, having them when a kid is young has a lot, less hours when you're young has much more impact than a ton of hours when you're in your 60s. So it's probably a consideration with kids to think about having a good pair of sunglasses, not to wear every second of every day, but on those bright days, and with when the UV index is high, it really does make a lot of sense.
yeah, no, that's huge.
Mm-hmm.
I guess that kind of brings up a topic that a lot of people, I don't know really anyone that knows a lot about tinted lenses in general.
Right.
Different colors.
Yeah.
What's your say on that? And then what I got to do is go on some other stuff and then just learn more about what you do with vision therapy, because I'm sure a lot of people are going to be very interested in that. But part of what I'm sure what you do is tinted lenses. We use colored lenses a lot.
Yeah.
We'll use, like in the functional neurology world, we use what we call hemifields.
Mm-hmm.
So we'll have like blue and red or black and red divided on one lens itself. So we have different midbrain modulation going on.
Right.
And so that's a whole nother topic. But then we have solid colors. We'll have colors of the rainbow, Roy G. Biv, and then a big one that we use is rose, which I find dampens the midbrain quite a bit. But what's your take on different colors and using them for different things?
Well, we do a lot of colored work as well. I think that there's a number of different ways that you can utilize it. So typically, the way that I'm often thinking about it, and I'm glad you brought up, that vision therapy aspect, because I think one thing I want to mention is that 50% of the overall vision therapy process is getting the right lenses in place. So I often think of it as,
For
the glasses.
color.
Yeah, exactly.
Okay.
Is getting them, color or strength or prism. So for me, we of course do training as well, the dynamic portion, but we don't train anyone unless they have the right glasses, whether it's tinted, prism, lenses. We have to start with that, or our ceiling becomes a lot lower. So it's a big part of it. We'll have many clients who just come, get that right prescription, and then work with other professionals on the recovery. So the training's a big part. But speaking to your point of tints, there's a number that are common. You referenced rose. FL41 is one of the well-studied tints for dampening light sensitivity. We find it's really helpful, particularly when you've got sort of like a chronic case of someone who's just had light sensitivity for 6, 12, 18 months. A little bit more common, what we usually utilize are different variations or shades of blue, which is interesting because you think, okay, we've got blue filters. We're actually talking more about changing the color as opposed to the frequency. And so what I mean by that is we'll have a light dusting of blue, usually somewhere between 10 and 30%, for a couple reasons. Number one, it's one of the best for reducing sort of that peripheral artificial light chatter. So, when people walk into artificial light environments, blue can tend to be, one of the more comfortable lenses. We will often trial between a rose and a blue, and depending on, chronicity, we'll kind of choose. The other thing that we can do with tints is we have a technique, it's called retinoscopy, where you can put different filters in front of people's eyes and you can use a point source of light and you can determine, do their eyes light up or do they darken? It sounds a little abstract, but you can actually kind of see which of these colors seems to be creating that most awareness and activity. So we've got
That's
a
cool.
range of 10 or 11 colors. There's a bit of a science behind it, termed Syntonic Phototherapy, which is a fancy, it's kind of like light therapy. It sounds similar to the work that you're doing, where we're trying to find which lens in their dress glasses, is going to be helpful. And then with phototherapy, we might do short exposures of, darker versions. But again, going back, we'll often kind of blue and a rose are really common. For migraine sufferers, there's a lot of research coming, around the green color as being a way of dampening, dampening the incidence of migraines. So we're those are some of our common ones. And then more bigger outliers are, we talked about someone who's struggling with night driving, motion detection. We might trial them more with kind of a yellow or an orange element. So in the dress glasses, we're often using subtle amounts of lenses to either make them more comfortable with artificial lights, screens, or bring down their headaches. And so that's sort of the glasses piece. And then similar to the work, it sounds like that you're doing with colors and filters, in the training world, we'll take them through this protocol of this syntonic phototherapy, which is, again, determining which filter kind of, we saw the best engagement, and then we have them wear it for short bursts of time. And Syntonics is a little bit more on, what color activates the parasympathetic nervous system versus the sympathetic. And so in the training, I'm thinking more about, okay, this filter seemed to be very activating of calm, that parasympathetic. With some of our kids, we might be using lenses that will push them a bit with sympathetic and parasympathetic to balance it out. So it's similar to the work you're doing. I hate keep using the phrase rabbit hole. There definitely is. There's things that we do in the training room, which is shorter exposures to maybe darker versions of tints. And then with glasses, we'll often have them wearing lighter versions, just because, again, natural light is good. Yeah, it's a big input. And, we probably don't need them exposed to this really intense therapeutic tint, 16 hours a day, all their waking hours. So there's a little bit of a titration that happens, but suffice it to say, we use color in a number of different ways. Did that answer your question, or was
100%?
Somewhat?
Yeah. Oh, that's really neat. I guess I didn't pay attention to that's how syntonics work. I was exposed to that terminology 2020 IAFNR. There's a great, I think she's an optometrist. She's out of, is it South Dakota? Okay. She's been given a couple of presentations, and she gave one this last year too.
Yeah.
But I didn't realize that's how it works. When we're in office, I'll look at someone's vitals, and then I'll do simple muscle testing. And so I'll look at their pupillary light reflex. Sorry. Mm-hmm. I'll look at even pulse ox, blood pressure, maybe even just monitor symptoms, and then put the glasses on and see how they do. Mm-hmm. But for instance, how powerful this is to explain to people is, just last week we had a guy come in, 21 or 22, had a terrible motorcycle accident. He's not walking. Now he can move his muscles, just very weak, and there's a lot to it. But I had him sit up, and he can hardly sit up. He doesn't have the core strength, so he's kind of all over the place. And sorry, moving away from the microphone. And what I did is I threw blue on, because blue in the functional neurology world, we use that a lot for just overall motor function. Mm-hmm. So it was a guess, obviously, but I threw that on, and then he stood still. And not only did he stay still, but he sat more upright, and he could resist me more. So if I sat there and tried to topple him over, he actually had more strength. Right. So and then his pulse ox actually improved too, which was kind of cool. But that might be not so much a important point to monitor with him. But blue is what he's going to get, for instance. But then hour later, a child with autism came in and they got what fit them the best was green. And then what we typically do is monitor that for, I don't know, 2 weeks, 4 weeks, kind of depends on the goal. And we just see, is that still a good color for you to have in office and at home? And then we might swap it out, or it might just be still very effective for them.
Yeah.
So,
yeah. And you bring up, I've heard so many really great theories and well-researched angles on, what is happening when we're exposing people to these different frequencies of light. There does, you're thinking about that. It sounds like you guys do great monitoring with pulse, all of that stuff, which is wonderful. There is a bit of an element there of, let's trial this for a period of time. We see a really nice response. This has worked for this type of patient for me many times. I would like to give you the opportunity to trial it and utilize it. And as much as, we're monitoring for light reflex when we're trying to figure out what we're utilizing, sometimes there's a little bit of intuition with some of the filters. It's kind of, here, this set of symptoms, I've had some great responses to this. And the nice thing with, it sounds like your glasses and the ones we have are, we can give people, a trial to utilize for a week or two. And let's kind of have you use this in, non-concerning environments and give me some feedback, and then we can titrate it from there. So I think for me, that's what I find endlessly fascinating is, everyone has a different lens on maybe what's happening. I think all of it is happening in different ways, whether, again, some of the oxygen saturation, sympathetic response, pairs. I think all of that's happening in a variety. Pupillary responses, we'll look for that too. We call it an alpha omega pupil, where it's kind of just vibrating up and down, and that they're not in this syntony of
almost like a hippus.
Yeah, exactly. And so you can use that as a really nice benchmark for, am I making a difference? But, experience, intuition, and then patient response, it's sometimes hard to get any better combination than that when you're utilizing different tints.
Yeah. Well, with the same individual, and it happens every time, and it's not because it's magic, but his parents were in the room and I put the glasses on. I'm like, oh my gosh. And then he's very smart individual. He's like, what about red? Red's my favorite color. I was like, yeah, you want to fall over? And he goes, it won't do that. Put him on him when he falls over. I mean, we caught him. He fell on the table, but it instantly affected him.
Right.
Which was, that was a pretty amazing response, even though it was bad, but that's how powerful it is. And like you said, whether it's a mix of the parasympathetic, sympathetic, and I don't know if it's controversial, but we use it a lot in the functional neurology world, dorsal stream, ventral stream, understanding. All of that is our justification, but totally, it was
And are you thinking about because we'll use those terms too from the input of the dorsal and ventral. And are you thinking about more the output kind of piece there, the motor output, it sounds like?
In his regard, yes.
Okay. Yeah.
Yep. And so then, like, if we wanted to work on dorsal stream with like an athlete, then I find myself typically using the BIVs, so blue, indigo, violets.
Yeah.
I don't know if that's right or wrong, but they tend to respond well. Then if we want to work on more details, so more of the ventral stream, especially with kids, I'm putting more like yellow, orange, red on them. And I think that helps pick up the details of things.
And contrast, for sure. Contrast, it definitely heightens that. So,
and contrast, almost like even with kids with Erlen syndrome, where rose might work really good for them. That helps them contrast. So for everyone listening, tinted lenses can be used for just about anything. You just have to make sure, you know what you're doing, or you find someone who knows what they're doing, because we use them. Dr. Rollett uses them for just about anything. And same here, learning disabilities to autism to someone recovering from a terrible accident, concussion. I think you had mentioned in your talk that you use, I think, blue quite a bit for concussion.
We do, and I think part of it is a little bit related to when people get in to see us for a concussion, which is we're not kind of the first stop on the train. You know, we're usually, people have almost always worked with functional neurology, have worked with physiotherapy, occupational therapy, maybe their family doctor, and they kind of hit that 3, 4, 5, 6 months. I'd say probably, yeah, that's kind of the average, maybe between 3 and 4 months when we see people. And blue is really common because a lot of people that we see come in with major artificial light sensitivity, and a very light dusting of that particular color can be very, very helpful in kind of a dress pair of glasses. The other thing is there's these different elements with colors, where blue, the way in which light gets into our eye, it actually creates a little bit of what we call a plus or a far-sighted number within their eye, whereas a yellow can create a little bit of a more minus or nearsighted response within the eye. So what we're often trying to do is calm their artificial light sensitivity, but maybe we want to give them a little bit more plus in their prescription, or maybe we want to give them a little more minus. So we're thinking about it in terms of, you know, there is kind of that symptom response, and then also how is this tint going to change the prescription that I'm giving someone. So that's probably maybe why we lean a little bit more on that as a, you know, 10, 20, 30%. But you do get anomalous response where that's just not the right fit for someone. So in those cases, what we sometimes will do is we'll get you glasses with no prescription, with no tint, and then we can give you clip-ons of a variety of different lenses and let people kind of trial that for a period of time. So it depends, I suppose, on how, you know, how much of a subjective response that you get. But it's a roundabout way of saying that, yes, that's a common color for us to use.
Cool.
Yeah.
Well, I kind of got a signal from Nick here. I guess almost an hour's already gone by. This is nuts.
Yeah, no, it's fun.
This has been amazing. I guess the last kind of topic is kind of go over vision therapy as a whole, because I don't think people know that such a thing exists. And if they do, I don't know, maybe they don't understand it. So
yeah, so the main kind of categories that again, we've got the optimized lens for someone. Again, that's about 50% of the vision therapy process. Now from there, vision therapy is somewhat analogous to physiotherapy for the visual system. So there are a number of muscles in and around the eyes that are involved with, again, we talked about creating sustained focus at near. We call it eye flexibility, so your ability to look near and look far. There's quite a complicated cascade of neuromuscular responses that have to happen. There's the pupil changes. There is the actual muscles within the eye that have to contract and relax. There's the actual muscles around the eye that have to contract and relax. And much of what we're doing, excuse me, from a mechanical standpoint, is working on building better flexibility and better efficiency of this neuromuscular cascade. Can they do the activity faster? So how do we do that? You know, how do you train these little muscles? Well, there's a number of different ways. I talked about Prism as being something you can add in the glasses to create support. We can also, in the therapy room, use Prism that pushes people in the direction that they've been avoidant of. We can use, we talk about in glasses, we can support convergence. In training, we can stress convergence. So we can actually make them have to add much more tension in short bursts, so that, again, our goal is, okay, if you can converge, let's say if you can handle 100 pounds of pressure, then handling 10 will become easy. So we use training prisms, which are often prescribed in the opposite direction of what we do with glasses. We go higher and higher and higher. So again, if they're always drifting to the right, we give them glasses to push them back. Well, why don't we actually train you to go this way and the other way, so that you can create flexibility? And the other thing that we'll often do, so again, that's maybe in the concussion world, is we use a lot of tools that separate the input between the right and left eye. So many kids, if they have a convergence challenge, or they've got a quote unquote lazy eye, that eye that's stronger than the other, they don't necessarily have a full awareness that that's what's going on. But when we put glasses on that separate the input of the right and left eye, let's say we got a red filter on one eye and a green on the other, and we've got red and green targets. If they're not seeing the red targets, they're getting very immediate biofeedback that channel's not turned on. And if you're playing, we'll do a lot of 3D TVs and video games, and we can even do it in virtual reality, where over time you coax that eye to have more awareness in these safe environments, so that when they go out into the real world, that starts to happen more and more. So we use training prisms to push people, out of their comfort zone. We use filters to separate the right and left eye, so they get this immediate feedback. Oh, I didn't realize I wasn't using my right eye, but now I can see it because I can't see the target anymore. So they blink, they touch, they use tactile feedback. And over the course of a number of weeks, they put on the filters. And even though we've separated the right and left eye, they're both in synchrony. So we'll use filters to break things down. And then again, so that's kind of from a visual standpoint. We work quite a bit collaborative with occupational therapy as well, to kind of work on the gross and fine motor elements. Because I talked about, vision leading the motor outputs. Well, developmentally, kids, first, it's kind of your gross and fine motor that are developing. And so when we see a kid who's maybe got a visual deficit, they've got, maybe quote unquote lazy eye or a deviated eye. If we're going at the point source origin, something is likely going on in that gross fine motor system. There was definitely some low tone. There was something in that area needs work and training and guidance. And, we're fortunate we have occupational therapy on our team. And so we can kind of work them through some of those sequences before we get to the eyes. But essentially, in a nutshell, it's a directed set of activities to work on making sure that your right and left eye are experiencing the world equally, because that guides our depth perception. If one eye is leading the other, your depth perception will be down, because that's kind of, how we calculate where things are in space. So we want to make sure they're working in synchrony. And then we work on these muscles in and around the eye to build flexibility and efficiency. And the beautiful thing is, these are not abstract topics. We have similar to yourself, we have very objective ways in which we can measure whether we've improved efficiency in this muscular system. So, yeah. and it's not, these are objective. It's not related on, the response. We can actually see and measure and document. We've published some literature on the impact on these neuromuscular systems, particularly in concussion. So we have an awareness that you can improve that efficiency. And that's really what it's about. I think, kind of in a nutshell, is we want to make sure that we optimize, have the most efficient visual system possible. I think the area where it gets dicey is because it seems abstract if you haven't heard about it. Sometimes people use the what do they call it? The straw man fallacy, where they might state that you are trying to, for example, cure dyslexia or cure autism with. That is not at all what's happening within vision therapy. And I don't think I've ever met anyone who would ever assert that. What we're doing is we're objectively building efficiency. We do quality of life, quality of visual comfort surveys, and we measure and see the gains throughout the program. So most people, it depends on the situation. They usually come in our office. I'd say 15 to 20 training sessions is common. For complex cases, you can get to maybe 30 or 40, but that might be, there's a lot of layers going on in those situations. But I'd say the sweet spot, they come to us once a week for their physiotherapy for their eyes for 15 to 20 weeks is really common.
Yeah. And that's fantastic. And maybe you can say that if this is true or not, but something I learned when I was taking really in depth in my functional neurology courses from one of the guys that a lot of people look up to, Dr. Brandon Brock, had stated the eyes are so complex that he said, I believe he said this, that the math of understanding how the eyes move cannot be explained.
Yeah.
Like he actually said, I think he said, we can launch a rocket into space. We know what's going on there with the math, but mathematicians cannot explain how the eyes move. Mm-hmm. It's that complex.
I haven't heard that quote, but that is absolutely certain to be true. The mechanisms of pulleys and adjustments and reorientation. There's 6 main muscles around the eyes, and then you've got this cascade of focusing within. And this is responsible for dynamic movement as well as feedback and integration with the inner ear and the neck. It is one of the most incredible systems in the human body is how the eyes move.
I mean, downright incredible. And a lot of us might take it for granted. And I'm not here lecturing anyone, but it is pretty amazing. And I'm not saying I've read a ton of research on eye movement or ocular motor therapy or anything along those lines, because I've read a decent amount, but the only time I see math is when they're calculating their statistics. I'm not seeing math on, or they might calculate how fast the eyes move, but they're not actually using math to explain how the midbrain integrates with the parietal lobe and the frontal lobe and maybe the pons and the cerebellum and the vestibular system to make that eye do what it's supposed to do.
Yeah. It's as you've alluded, it's just the deeper you get, the more questions you have, meaning that, it's not that it gets murkier. It's that when you first start to look into a topic, it seems simple. Oh, you help the accommodative system go near and far or faster. And then as you start doing that, you start to realize, oh, there's actually all these other elements in play that we need to integrate. And I've talked about this collaboration. It's like, well, they can do this well, but they're complaining of tension back here. How is that playing into what's going on with accommodation? So, I mean, the deeper you dive into anything, when you're involved in sort of the rehabilitative space of neurology, the deeper you dive, the more humbling it can become. And the more you sort of you need more people to give you their perspective to open other doors, because but that's, I think, what makes it rewarding long term. Yeah. And why it's always fascinating to me.
Well, and that's why that's why I asked to have you on, because I was like, oh, this is an eye opener, no pun intended. I'm like, oh my gosh,
right?
There's so much information. And is there anything else you want to say? What is your website? We'll have that in the notes, but
we're OkanaganVisionTherapy.ca. It's a bit of a mouthful. Okanagan's the region that we're in, and a couple things we do have. People are often wondering, do I need to go see someone who does this work? We have a really quick. We don't collect emails or anything with this. We've got a quick screening test where we've got it screens for peripheral and central integration. How efficient is someone? It's just this grid. It's called an aliasing grid. And then we ask you 15 questions. It'll auto tally it. And if you're above a certain amount and you found the grid uncomfortable, you likely might want to seek out some help from someone who does work in this area. So I'd say, we do have lots of blogs and resources. I talked about, we've got lighting resources, lots of things to kind of, help the general public, but that might be the most useful thing. Again, it's not, you don't have to come see me. It's just, okay, if you do that, you do this test, something's off, you might want to find someone who's, has a special interest in neuro-optometry or developmental optometry.
Cool. Cool. Well, is there anything else you want to leave everyone with?
No, I just wanted to thank you for having me on. And I always really appreciate talking to someone like yourself, where you're inquisitive and humble. And I think that's, to me, that's what, the rehabilitative community should be. Even some of the things you referenced and talked about, different red and black on the glasses if I was interviewing you, I would want to know what that's all about, because it sounds fascinating. I'm sure you get wonderful results. And I think just keeping an open perspective and an open mind and, just being inquisitive and kind to each other within the rehab community goes a really, really long way. So I just wanted to thank you for having me on, and for those who listen.
Oh, thank you. And I am making a note to send you information on the Hemifields.
Please do. No, it sounded fascinating. I just, I'd love to just sort of learn more about it. That would be great.
Yep. I'll send you pictures and you'll have to eat it up. It's pretty cool.
Yeah, no, that's great. I appreciate that.
Cool. Well, all right. Thank you again, sir. Mm-hmm. Much appreciated. Again.
No, my pleasure.
This is awesome.
Yeah.
All right. Well, thanks for coming on again.
No worries. Yeah. Good to see you. Take care.
Thank you. All right, everyone. The Dr. Alex Show is brought to you by Apex Energetics, apexenergetics.com. First of all, to learn more about Apex Energetics, head on over to that website. If you want to get Apex Energetics directly, please call them 1-800-736-4381, or you can shop our online store. You can get to our online store at myhcpstore.com. Username is Dr. Alex. Otherwise, if you'd like to find a doctor that uses Apex Energetics, you can give them a call or go to the website and they'll direct you to a doc in your area that should be doing very good work with Apex Energetics. Apex has just been instrumental in our lives professionally and personally. About 6 years ago, we went through one of the most hellacious traumas that you can think of. And if it weren't for Apex with their stress support line of products, I probably would not be here. Point blank, period. And in the office, making the switch from other lines to Apex Energetics has sped up our results with our patients, supporting them through their healthcare needs, probably by 25%, if not more. And when it comes to Apex Energetics, we just want to remind everyone that we are here to not cure diseases, making claims. We're here supporting people, increasing their healthcare needs, and helping them achieve their goals. ApexEnergetics.com. The Dr. Alex Show is hosted by myself, a nerd, Dr. Alex Nelson. I'm a chiropractor, board certified in functional neurology and childhood neurodevelopmental disorders. The show is available on Apple Podcasts, Google Podcasts, Spotify, or most any of your other favorite podcast apps. The Dr. Alex Show is a production of Fredcasts. Think, Speak, Act.